Good afternoon, everyone, and welcome to our Facebook Live. Today we're going to be talking with Claire Northington, a nurse practitioner at Fulton Medical Clinic. Claire has been a nurse practitioner for 16 years and has been with Fulton Medical Clinic since 2019, and we're glad to have you with us today.
Thanks for having me.
Claire, let's get started by talking about wellness visits. First of all, why is it important to see your doctor or nurse practitioner every year?
So we've all heard the old adage that an ounce of prevention is worth a pound of cure. And that concept is the foundation for all annual wellness visits. Annual wellness visits are important to allow your primary care provider an opportunity to order any screening tests that are due, order any vaccines that are due. It gives us an opportunity to talk more in depth about mental health and stress levels. But the most important thing is it gives us an opportunity to assess for signs and symptoms of disease early, which allows for early intervention and theoretically better outcomes.
Okay, good. And I know that some insurance companies cover an annual wellness visit, and Medicare also does. What exactly is a wellness visit, and what kinds of things are included there?
So there are two components to a Medicare annual wellness visit. The first component is a cognitive assessment. The cognitive assessment is going to screen for signs of dementia or mood disorders, and examples of that would be Alzheimer's disease or depression. The second component of a Medicare annual wellness exam is a personalized prevention plan, and your primary care provider will take into consideration your cognitive assessment, your age, your gender, your family history, personal history, and develop a plan for disease prevention. That may include things like vaccines, screening tests, diet interventions, fall prevention plans. It may even include other lab work or anything that your provider feels is important in order to keep you healthy.
Okay, good. And is there a cost to an individual for a wellness visit?
So Medicare wellness exams are free to the patient. The Part B $200 deductible does not apply. The 20% copay does not apply. So a Medicare wellness exam is essentially free to the patient. We as healthcare providers do bill Medicare for our services, and Medicare does reimburse us.
Okay, good, but no cost to the patient.
No cost to the patient.
That's good. How does a Medicare wellness visit differ from a wellness visit covered by other insurance companies?
So there's going to be several differences, and one of the first differences is that Medicare annual wellness visits are going to be they're not on a calendar year time frame. So most insurance companies are set up on a calendar year time frame. Medicare is not. You have to wait a full calendar year from your last wellness visit before you are eligible for another wellness visit. An example would be if you had a Medicare wellness visit in December of 2020, then you would not be eligible for another Medicare wellness visit until December 2021. Other insurance companies may be on a calendar year time frame, so you could have a wellness visit in December of 2020, and then you could have another wellness visit in January of 21, even though they're only a month apart because they're different calendar years.
Okay, but only one for the year.
Yes, just one for the year.
Okay.
Another difference between the Medicare wellness visit and other wellness visits is that there are no exam requirements or lab work requirements with a Medicare wellness visit. So most insurance companies want us to perform and document a head-to-toe physical and perform some sort of lab work, usually a glucose and a lipid, on the same date of service that we perform the wellness visit. But Medicare does not have that requirement. The only components that are required by Medicare for a wellness visit are the cognitive assessment and the personalized prevention plan. Another difference between Medicare wellness visits and normal insurance or private insurance wellness visits is that I can combine a Medicare wellness visit with a routine checkup. And I rarely will do a Medicare wellness visit by itself. I find that it's easier for me and for the patient to, if I incorporate the components of the Medicare wellness visit in what I normally do for a routine checkup. Other insurance companies won't let us do that. We have to only do wellness visits on the wellness visit day. I can't talk about any blood pressure or address a problem unless it's Medicare, and I can do it all at the same time.
Okay, good to know. For those of you just joining us, I'd like to reintroduce our guest. We have with us Claire Northington. She's a nurse practitioner here at Fulton Medical Clinic, and we're talking about wellness visits and also about preventive health screenings. I'd also like to mention that we encourage you to post some questions in the comments. If you have anything you'd like to ask, Claire will try to answer them as we have time today. Hey Claire, let's talk some about the screenings that someone might expect to have done during a wellness visit. I'm assuming that these would vary based on the person's age, medical history, things like that. Can you tell us a little more about that?
Sure. So we order screening tests based on factors that you just mentioned: age, gender, personal history, family history, lifestyle choices. There will be some folks that may qualify for some things, and there may be folks that don't necessarily need that screening test. And so we will take time during the annual wellness visit to review all of those factors and order what is appropriate. Most folks will qualify for a colon cancer screening test called a colonoscopy at age 50, but others may need that sooner depending on their personal history or their family history. People who have a smoking history and are of a certain age may qualify for a lung cancer screening test. Women of a certain age will qualify for a breast cancer screening, and men of a certain age can qualify for prostate cancer screening. So a wellness visit, an annual wellness visit, is a perfect opportunity to allow us to see what do you need, what have you had done, and what do we need to do next.
Okay, good. And I know that some of the screening tests, like the lab work you mentioned, are done here in your clinic, and others have to be done elsewhere, like a mammogram or a colonoscopy. How would someone find out their results from these tests?
So typically, anything that I order, I will give you the results for, with a couple of exceptions. Colonoscopies are not done here in this office. The results of a colonoscopy are going to be given to the patient by the doctor performing the colonoscopy, usually on the date of service of the colonoscopy. Other tests that are not performed in this clinic, such as mammograms, low-dose CT scans to check for lung cancer, because I'm the one who's ordering them, I will get the result, and then I will notify the patient of the result. And we notify patients in various ways, from telephone calls to letters through the mail, and sometimes we bring them back in to talk face-to-face depending on the result of the test.
Right. And I guess My Connection.
Absolutely. And My Connection, if anybody is a patient of our system and has not utilized My Connection, please do, because it makes things very transparent. You can see your test results, and I like that. I like for patients to have access to these things.
Yeah, good. All right. Well, we can't really have a discussion these days without talking about COVID-19, and I know that the pandemic has changed the way we do a lot of things over the past year and a half, and a lot of people have put off having routine medical care like we've been discussing today. I know that you at this clinic and our other clinics do virtual visits now. Can you explain a little bit how that works?
Sure. So we have the capability of doing virtual visits or telephone visits. Patients who have a computer or a smartphone or a tablet that have an internet connection will be able to do virtual visits if they choose. And that is where we will kind of call each other either on the using the cell phone or using your computer through your email, and we can see each other, we can hear each other, similar to FaceTime or Skype. So that is an option for folks who don't want to come into the clinic, can't come into the clinic. Telephone visits are exactly what they sound like they are. We will call you, talk about the things we need to talk about, and hang up. We can do Medicare wellness visits virtually. We can do them on the telephone, or we can do them face-to-face.
That's good to know. It's a lot more convenient for a lot of people,
Sure.
too, not to have to get out. So, Good. For people who do come to the clinic, things may look a little different too. How are things different now than they were before the pandemic?
So we require masks to be worn at all times while in the clinic. We have sectioned off certain areas of the front lobby and the lab waiting in order to allow for social distancing. We clean the room thoroughly after each patient. We clean x-ray thoroughly after each patient is in x-ray. And that may slow room turnover down a little bit, but it's very necessary in order to help keep folks healthy.
Good, so taking lots of precautions on that. Well, Claire, I think we've pretty much covered everything I wanted to cover. Is there anything else you'd like to say before we go?
I don't think so. I will say that if you haven't had your annual wellness visit this year, then talk to your primary care provider or schedule that appointment. Seeing your primary care provider every year is important, even if you're not feeling bad, just for health maintenance, in order to get the things that we've talked about arranged and done and those boxes checked and try to keep folks healthy.
Good, yeah, that's our main goal, is to try to keep everyone healthy. Well, I'd like to thank you, Claire, for spending some time with us today. Just a reminder that this Facebook Live will stay on our page, so please share it with anyone you think might be interested. Thank you again, Claire, and thank you to everyone who joined us today. Have a great rest of your day.